So it was really difficult getting news that something might be wrong with our baby at the time, because this is considered a rare condition.
Rio and Rebel have a condition called ARPKD, or autosomal recessive polycystic kidney disease. So it affects many different aspects of their life, but the organs that have had the most involvement have been their kidneys.
For a tiny person or baby, it really distends her abdomen and pushes on her other organs, makes it difficult to eat. Your kidney's really, really important. It processes a lot of different things, potassium, sodium, and causes high blood pressure, which is ultimately the main problem Rebel has is high blood pressure.
Rebel, who's the older sister, was diagnosed first based on changes they saw on her kidneys early in life. Knowing that Rebel had this disorder, then they certainly looked for that early during pregnancy, and they were able to determine that Rio also had the problem.
I've been doing this for over 20 years, and this is the first time that I have seen that both children are able to receive their parents' organs. So this is a pretty cool opportunity that we're able to see with the Timpson family.
Matt and I were both like, well, of course we're going to get tested. Later we kind of were told it's actually not as common for parents to be able to donate for lots of reasons, whether, genetically or, it is hard to be the caregiver and also donate.
The actual process for a living donor kidney transplant starts across the street at St. Louis University Hospital. That's where the donor is and the donor surgery is. And then the kidney, once it's out of the body, goes into a special preservative solution and then is brought over here from St. Louis University Hospital to the OR at Cardinal Glennon, where the child is located and is ready to receive the organ to be placed inside of them. Well, I think we do have an experienced team of transplant surgeons as well as nephrologists, coordinators for transplant, nurses and dietitians, social workers. So a large group of people that all work together in order to make transplant a possibility for a patient and family, and to try to make it successful.
So seeing Rio explode over these last 6 months post-transplant has been a fun journey to watch. She's always been rambunctious, but her energy level and her spice for life has definitely increased. So my hope is that Rebel can now be that sibling right back.
Everyone knows our kids when we come in. They're, hi Rebel, hi Rio. It definitely feels like family. And so when we had Rio, it was the same thing. We wanted to make sure that she had the same level of care, and so we always come here.
It has been so fun to see Matt and Maggie flourish through all of this, because this is not easy for them as parents to know that both of their kids have chronic illnesses. But Maggie and Matt have definitely stepped up to the plate and shown they are beyond invested for their kids. They're more than just mom and dad.